Hey guys, it's Health Inclined TV and welcome back to my channel. Did you know some diabetes symptoms show up at night? Recognizing these signs can have a huge impact. In this video, we'll delve into the important indicators of diabetes that often present themselves at night. From frequent urination to unusual cravings, these nighttime signs provide crucial information about possible underlying health issues. So, if you're curious about how to better understand your body and potentially catch diabetes early on, stick around and don't forget to share your thoughts and experiences in the comments below. Also, check out the link in the description for our exclusive ebook on sugar and diabetes. Let's get started. Have you ever found yourself waking up multiple times during the night needing to use the bathroom? This could be nocturia or frequent nighttime urination, and guess what? It could be linked to diabetes. When you have diabetes, there's an excess of sugar or glucose circulating in your bloodstream. This excess sugar acts like a magnet for water, pulling it out of your body's tissues. Your kidneys work overtime trying to flush out that excess sugar, leading to more frequent urination even during the night. This constant need to pee can seriously disrupt your sleep, leaving you feeling exhausted during the day. So, if you're finding yourself making frequent trips to the bathroom at night, it's time to pay attention to your body's signals and talk to your doctor. Nobody functions at their best when they're sleep deprived. Let's talk about those dreaded night sweats. Waking up drenched in sweat can be a sneaky sign of diabetes, specifically nocturnal hyperglycemia. Hyperglycemia means low blood sugar, and nocturnal means it happens at night. When your blood sugar drops, your body releases hormones like adrenaline and cortisol. These hormones trigger increased heart rate, sweating and trembling. It's your body's way of trying to raise your blood sugar levels back to normal. So if you're waking up in a pool of sweat, it's essential to talk to your doctor to rule out any underlying medical conditions like diabetes. Don't ignore these signs. Hyperglycemia can manifest in other ways during the night too. Imagine being jolted awake with a racing heart, clammy palms, and overwhelming anxiety. You might even experience blurry vision or feel confused and disoriented. These are classic symptoms of hyperglycemia or low blood sugar disrupting your sleep. Even when you're sleeping, your body needs a steady supply of glucose to function. If you have diabetes, your body either doesn't produce enough insulin or has trouble using it effectively. To manage hyperglycemia, monitor your blood sugar levels regularly, especially before bed. Eating balanced meals and having a bedtime snack can help maintain stable blood sugar levels overnight. Another sign is restless leg syndrome. Imagine trying to relax, but you have an uncontrollable urge to move your legs. RLS is a neurological disorder causing uncomfortable sensations in the legs, often worsening at night. Studies show a strong link between RLS and diabetes, particularly type 2 diabetes. High blood sugar levels can damage the nerves in your body over time, known as peripheral neuropathy. This nerve damage can lead to symptoms like numbness, tingling, pain, and restless leg syndrome. The damaged nerves send mixed signals to the brain, causing those uncomfortable sensations. Managing RLS often involves addressing the underlying cause, which, in the case of diabetes, means keeping your blood sugar levels in check. Don't ignore these signs. Another sign is sleep apnea. Sleep apnea is a sleep disorder characterized by pauses in breathing or shallow breaths during sleep. These pauses can last from a few seconds to minutes and can occur multiple times throughout the night. Studies show a strong link between sleep apnea and diabetes, especially type 2 diabetes. One reason for this link is obesity, common in both conditions. Excess weight can put pressure on the airway, making it more likely to collapse during sleep. Insulin resistance, a hallmark of type 2 diabetes, can also interfere with the brain's control of breathing during sleep. This disruption can lead to breathing pauses and shallow breaths, characteristic of sleep apnea. Another sign is increased thirst. Waking up in the middle of the night feeling incredibly thirsty can be a sign of diabetes. Excessive thirst or polydipsia can be caused by high blood sugar levels. When your blood sugar is high, your kidneys go into overdrive trying to filter out the excess sugar. They start pulling fluids from other parts of your body, including your mouth, to try and dilute the sugar in your bloodstream. This leads to dehydration and that insatiable thirst you might be experiencing. So, if you're constantly reaching for your water bottle, especially at night, it's essential to pay attention to your body's signals and talk to your doctor. Don't ignore these signs. Another sign is fatigue. Fatigue can be caused by a variety of factors, but it can also be a sign of diabetes. When you eat, your body breaks down carbohydrates into glucose, which enters your bloodstream and travels to your cells to provide energy. If you have diabetes, your body either doesn't produce enough insulin or has trouble using it effectively. Without enough insulin or with insulin resistance, glucose can't enter the cells efficiently, leading to high blood sugar levels. As a result, your cells are starved of energy, even though there's plenty of glucose circulating in your bloodstream. This energy deficit leads to fatigue, making you feel tired and sluggish, even after a full night's rest. Don't ignore these signs. Let's talk about dry mouth, or xerostomia, a common condition that can impact your oral health. Dry mouth occurs when there's a decrease in saliva production. Saliva plays a crucial role in maintaining oral health, keeping your mouth lubricated, washing away food particles, and neutralizing acids produced by bacteria. High blood sugar levels can contribute to dry mouth. When your blood sugar is high, your body tries to get rid of the excess sugar through your urine. This process requires extra fluids, and your body may start pulling fluids from other areas, including your salivary glands. This decrease in saliva production can lead to that uncomfortable dry mouth sensation. We all know how important sleep is for our physical and mental health. But for people with diabetes, getting a good night's sleep can be a constant struggle. Diabetes can lead to a variety of sleep disturbances that can leave you feeling exhausted and drained. One way diabetes interferes with sleep is through fluctuations in blood sugar levels. High blood sugar levels can lead to increased urination, causing you to wake up multiple times throughout the night. Low blood sugar levels can trigger the release of hormones like adrenaline and cortisol, causing night sweats, tremors, and a racing heart. These nighttime hypoglycemic episodes can be particularly disruptive to sleep. Don't ignore these signs. We've covered a lot of ground today, discussing the various nighttime symptoms that could be signaling diabetes. From frequent bathroom trips to those annoying leg twitches, these signs, while subtle, shouldn't be ignored. Early detection is key when it comes to managing diabetes effectively. If you've been experiencing any of the symptoms we've talked about, don't panic. Knowledge is power. And now that you're more aware of these potential warning signs, you can take charge of your health. The first and most important step is to reach out to your healthcare provider. They can assess your individual situation, run the necessary tests, and provide personalized guidance based on your specific needs. Living a healthy lifestyle can go a long way in preventing and managing diabetes. So that wraps up our exploration of nighttime diabetes symptoms. As we've learned, diabetes can manifest in various ways, and some of its signs are more noticeable during the night. Remember, these symptoms are not a definite confirmation of diabetes, but could signal the need for medical advice. If you're experiencing any of these signs, it's best to seek guidance from a healthcare professional. Diabetes is a widespread condition, and recognizing its symptoms, especially those that occur at night, can aid in early detection and management. So that's it for today, guys. Remember to hit the like and subscribe button if you found the video helpful. And as always, stay informed, stay healthy. And don't forget to check out the link in the description for our exclusive ebook on sugar and diabetes. It's packed with valuable information.